For me, this rebranding means about the continuation of what this place has always done, as well as a new path forward as we look to reinvent what this place needs to be for this community. This place has provided quality care for this community for many, many years.
When Richmond Memorial Hospital first opened its doors September 18, 1920, it had 25 beds, a staff of 8, attending physicians, and resident doctors of 19. I think over here is more people that they had when they first started.
It represents a whole new recommitment to the community here and to the revitalization of this hospital.
Making sure that our patients are protected, that the emergency department is always here for you, but on top of that, being able to provide outpatient services that this community needs, right, in a white glove manner, to be able to provide orthopedic care, radiology care, and going forward, a lot of other things that we're going to be able to do here in a way that we're really proud of.
By the end of 2020, we successfully performed 300 total joints with amazing feedback from our patients.
This hospital and the North Side merged in '87, and I think it was probably one of the first mergers of hospitals in the New York area. The origins of this facility goes back to 1919, 1920, when Bertha and Louise Dreyfus contributed $100,000. And now today we're doing something, again, that's new.
You know, it's funny, I think if you actually asked Bertha right now today, what does she think? I think she'd be incredibly proud, right? Because this allows this institution to move forward and to yet again add services that we can provide to this community. This community can now come here for an MRI very soon. This community can come here for their joint replacement. And there are more and more things the South Shore of Staten Island doesn't have to leave the South Shore for. And really, from everything I've heard about Bertha Dreyfus, that's what she would want.
And I remind people all the time, the innovation and the creativity that we displayed during COVID. Imagine we continue the essence and that philosophy of entrepreneurship. Imagine what we can do going forward. The Staten Island community is unbelievably important. It's a special community. And the hospitals here in Staten Island, both this one and the North Side, are integral key parts of Northwell and of the Northwell strategy and of the Northwell organization. And if there is one thing that has been proven in the last 18 months is the essential nature of healthcare workers and the essential nature of hospitals and the importance of hospitals. And not just the physical plant aspect of it, but the commitment and the dedication of the staff and the entrepreneurship that has evolved out of here over the many years. So this is a core part of the Northwell DNA.
At our centennial celebration back in May, Kevin Biner said it best. This is not a pile of bricks, it's not a historical monument, it's a building where your neighbors care for your neighbors.
So the name is important but it represents something new, a new journey, looking to the future in a bright, positive, optimistic way, and committing to make sure that the original intent of this hospital, which was to serve the community in a holistic way, that we revisit that commitment and we continue to invest, grow new programs, expand the services, reach out to the community more, work in tandem with the community. And I think that name represents that new beginning of a new journey.